Hi, I'm Krissy Bielewicz with the Journal of Allergy and Clinical Immunology. I'm here today at Cincinnati Children's Hospital with Drs. Hershey and Brandt, authors of Diesel Exhaust Particle Induction of IL-17A Contributes to Severe Asthma. Dr. Hershey, can you discuss the importance of traffic pollution and its association with asthma?
Sure. Traffic pollution is a very prevalent global problem. We've been studying it for some time in a birth cohort study, the Cincinnati Childhood Asthma and Air Pollution Study, where we've looked at the effect of traffic pollution exposure on the development of wheezing phenotypes in early life. And what we found is that there's a dose-dependent relationship between the amount of traffic pollution that a child is exposed to early in life and their risk for developing wheezing and for having asthma at age 7. And that the timing of this exposure that's most important is really the first year of life. Several studies, there's considerable evidence now that traffic-related air pollution is important in the development of asthma and the development of asthma symptoms, but very little was known about the mechanistic basis for the contribution of traffic pollution to asthma, which led us to this study.
Dr. Brandt, can you elaborate on the mechanism of how traffic pollution contributes to asthma?
Sure. I wanted to highlight 3 points. The first being that exposure to diesel particles by itself did not induce airway hyperresponsiveness and the features of asthma, whereas when DP is combined with an allergen, this repeated co-exposure exacerbates asthma symptoms. This exacerbation we were able to demonstrate is partially dependent on DP-induced Th17 response because we use an antibody directed against IL-17A, and by blocking IL-17A we were able to abrogate the airway hyperresponsiveness.
Dr. Hershey, can you discuss the clinical implications of your study?
Sure. So as Dr. Brandt outlined, DP exposure, traffic exposure, contributes to asthma severity, and in the context of allergen, it actually increases asthma severity. IL-17 is increased in the face of DP exposure, and the contribution of traffic pollution to asthma severity can be aggregated by an antibody to IL-17. There are several monoclonal antibodies that are in phase 1 trials and phase 2 trials that target IL-17, both its receptor and the cytokine itself. So this study has several clinical implications, notably that anti-IL-17 treatment may be very useful in patients who have severe asthma, especially those who are exposed to high levels of traffic pollution.
Thank you both for taking the time to talk to me today. Appreciate it. If you like this video and like to see more, please visit our YouTube channel. Thank you.